Hello, everyone, and thank you so much for tuning in. Full disclosure, my wonderful microphone broke while I was traveling a few days ago. Okay, I guess I wasn't careful enough when packing it up. Okay, I admit it. And so this episode is being recorded through the microphone in my computer. I'm so sorry. The sound isn't great, but I promise you the content will be a heck of a lot better. So stick with me through this episode. And for sure, the new microphone I've had my eye on for months will arrive in time for next week's recording. I know it will. But like they say on Broadway, the show must go on no matter what. So on we go. Hello, everyone, and welcome to GRUFFtalk, where each week we take a deep dive into all the ways we can feel better, look better, live better, and age better. Yep. If you have questions or ideas for future episodes, email me at grufftalkpodcast@gmail.com, or you can reach out on social media. Would love to hear from you. So glad you're tuning in today to talk about something that affects so many women, so many. Hair loss. But the good news is that there are solutions to the problem, and that's a big chunk of what we're going to be talking about today with my very special guest, Dr. Doris Day. I'm your host, Barbara Hannah Grufferman. One of the most asked questions I get is about hair loss. Why is it happening? What do I do? Make it stop. My guest today is here to help. Dr. Doris Day is an award-winning, board-certified dermatologist who specializes in laser, cosmetic, and surgical dermatology in New York City, and she's a clinical associate professor of dermatology at NYU Langone Health. Dr. Day regularly travels around the world. She lectures and teaches other physicians the art and techniques of rejuvenation. She's written 3 books, and we'll have links to all of them in the show notes and also on my website. She's a freelance journalist for several medical and scientific publications, and she is the host for her own award-winning dermatology show on Doctor Radio, which you can hear on Sirius XM 110. And you know, she's always on TV. You have seen her on TV. She's been on the Today Show many, many times, live with Kelly and Ryan, and so many more. On top of all these accomplishments, Dr. Day is an extraordinarily beautiful woman and just an all-around lovely person who really believes with her heart of hearts in the power of positivity. And she wants women to feel pretty and confident and powerful, no matter what their age. We have so much to talk about because not only will we take a deep dive into hair loss, today's topic, but then Dr. Day will also answer the questions that you send in to me by email or on social media, all about skincare. Okay, so let's get this show started. Hello, Dr. Day, and welcome to GRUFFtalk.
So good to be here with you.
Yeah, we have a lot to talk about. And listen, this is really funny. When listeners heard that you were my next guest on GRUFFtalk and the topic was going to be hair loss, the floodgates opened up and the questions poured in, mostly by email. I've consolidated a few of them, so let's get started with them. But before we get to the questions from the listeners, let's start with this. What are the main reasons women experience hair loss? Why is this happening?
There's hair loss and there's hair loss. So a lot of times I see women who come in who are concerned about hair loss, and what they're having is an accelerated shedding, and that's called telogen effluvium or stress shedding. And that is, who hasn't had a reason for stress shedding over the past few years, right? With all we've been going through. And what happens is that your hair has cycles. It has a growing cycle, a resting, and then a shedding cycle. And telogen is one of those cycles. When it gets pushed into that resting phase, it sits there for 3 to 4 months. So the growing phase is 2 to 10 years. That's why our hair gets long on our head. And then it rests for a few months. And then over the next few weeks, it falls out and then it grows back. when you go into a stress pattern from a major physiologic stress, whether it's what we went through with the pandemic or a marriage, a divorce, a death, a birth, a job change, a
Or even
relationship change,
surgery, right?
or
Something like
surgery
a
or
physical
chemo,
trauma.
all
Hmm.
of those things, right? Any major stress on you will push your hair too synchronously. So instead of 90% of it being in the growth phase, all of a sudden 40% of it shifts over into that resting phase where it will sit for 3 to 4 months and then it'll fall out and grow back. So when you see that shedding, chances are your stressor was 3 to 4 months before that. And everybody looks and they go, oh, my hair is falling out. What's going on now? It's actually a reflection of what happened 3 to 4 months before. And you can have a chronic telogen effluvium where you just keep going through major stressors. And in the end, even though the hair is growing back, it's a net loss because you're shedding so much still. So that's one of the most common types of hair thinning that I see, but it's not actually a true hair loss because that hair is growing back, except that
It'll
over
come back.
time, it
Okay.
feels like it's thinning. Now, one of the things I've noticed is that people who go through that telogen effluvium, the chronic stress shedding, not just one moment in time and then it grows back, but who tend to live in a stressful state, it can accelerate hair aging and also androgenetic or genetic patterns of hair loss. So if you have a family history from your mother or father's side of hair thinning or hair loss, where they go bald basically, or women and men have different patterns, but when they lose their hair, then you may see that before you're genetically programmed to really see it, because you've now added this added stressor that's going to accelerate the aging.
So, what about menopause and women who are postmenopausal? I mean, we really do tend to see a lot of hair thinning and hair shedding and hair loss during that time of life. So, what's the connection there?
Yeah, menopause is a big deal because your estrogen goes down. We need estrogen for just about everything. I personally
Hmm.
am very against menopause. I think that one of the
I love it. We're going
things
to
that women
protest menopause.
I protest menopause on a daily basis in my practice. When I look at how misled women were through this whole menopause debacle with the Women's Health Initiative study, what they
In
did in that study,
2002. Yep.
yeah, what they did was they were trying to show how estrogen was so good, but what they did was they took women who were well past menopause because they needed older women because they're trying to show longevity, right? And if you started at 50, it's going to take too long to do the study. So they started with older women who had been well past menopause. They picked women who were asymptomatic because they thought, well, if we pick women who are symptomatic, then the people who are in the placebo group will drop out because they'll stay symptomatic and they won't want to stay in the study. So they picked asymptomatic women. Then they
Hmm.
picked women who were also overweight, had diabetes and other illnesses. And then on top of all this, they used horse urine estrogen, which is not bioidentical, and they used synthetic progesterone. So they had all these things wrong with the study. And in the end, the rate of breast cancer went from 4 out of 1,000 to 5 out of 1,000, which, if you look at it as a relative risk, you can say it's a 25% relative risk. But if you look at the absolute risk, it's very low. It's less than 1% absolute risk increase of breast cancer. But the data made the headlines of the newspapers even before the articles were peer reviewed. And so now women say, oh, there's a 24, 27% increased chance of breast cancer when it's not true. And then if you looked at women who had a hysterectomy, so they didn't have a uterus and only got estrogen, not estrogen and progesterone, the estrogen, and just remember, these were older women, postmenopausal, other morbidities. I don't even know how they would make it into a study with the things going on. They actually seemed to trend, it wasn't quite statistically significant, but they were trending towards less breast cancer if they only had estrogen, not progesterone. So unfortunately, women are so afraid and they don't think of all the benefits like hair and lower risk of
Skin.
osteoporosis
Yep.
and less collagen breakdown, less dementia, all of those
Hmm.
things. So a lot of my conversations with women around perimenopause is, when is it a good time to start? Because the earlier you start, the less of those changes you'll see. So what you're talking about menopause is natural hair aging. And natural hair aging happens really starting even in your 30s, where over time our hair will become less dense. Each fiber can be less thick. And you will notice that your hair doesn't quite have the same texture. And then as it turns gray, the texture changes again. So there's lots of changes. And then the hairline can recede up a little bit. So you have more forehead show and your brows can drop. So a lot of stuff happens. It doesn't sound so pretty, but it doesn't have to be bad. We just have to adjust our hairstyles and sort of understand that one of the things that I think is really important to understand is that we naturally, instinctively care about hair. It's not that anybody chooses to be upset that their hair is shedding. It's actually hardwired into our DNA to think of hair as a sign of fertility and health. So when we see thinning hair, we instinctively feel less attractive, less viable, less fertile, less relevant. And so I get why people are so upset about hair loss. It's not that they're being frivolous or vain. It's that it's really genetically programmed for us to feel that way.
That's really very interesting. And I also saw studies a few years ago about women who, if they're having a really bad hair day, I mean, really maybe even experiencing some of this shedding or hair loss, and just their hair just doesn't look the way they want it to, they won't go on a date. They'll even stay home from work. Like they'll take a sick day if their hair is really not looking well. But that's interesting about being hardwired for it. So here's a listener question. What role does either testosterone or having a thyroid deficiency have to do with thinning hair or hair loss?
The thyroid question comes up a lot. And I have a lot of women who come in who tell me that they have either Hashimoto's or Graves, where they feel like that's connected to the hair. And testosterone, we don't really know. I think progesterone replacement is helpful for hair. So for women who are going through menopause, who are not sure about whether or not they want progesterone, if you can tolerate it, I think it does help with hair even more than testosterone. So women actually have more testosterone than they do of estrogen. Estrogen is really important. Testosterone replacement for women there's not a lot of good data on this, not a lot of good studies on it. Too much testosterone can lead to hair thinning, but you'd have to have pretty high doses of that to really see the acne and the hair issues with that, the balding that could go with it. So I don't think about testosterone too often. The other issues around hair with hormones, with thyroid, is that any major physiologic stress and hormone fluctuations are physiologic stressors can lead to a stress shedding. And thyroid disease is typically autoimmune. So you can have an autoimmune driver of hair shedding as well. That's the other type of hair shedding. So we mentioned the stress shedding, the genetic form, which is called androgenetic. And then the third type is autoimmune, called alopecia areata. And that's also a non-scarring type of hair loss that can involve hair anywhere on your body. It could be your lashes, your brows, your scalp, your pubic hair, your underarms, anywhere you have hair, you can have patchy hair loss. And if it's very severe, it's called alopecia universalis, where you lose all the hair on your body. So it doesn't typically progress to that, but it can. And it's unfortunate when it happens. And the longer you have that hair loss, the harder it is to grow back. But we're finding that there's some drugs now called JAK inhibitors, Janus kinase inhibitors, that are now FDA approved to regrow hair. It's called Olumiant, is the brand name of that drug. And that, in that severe form of autoimmune hair loss, has been shown to regrow hair. One of the unfortunate side effects of that drug is that it can cause cancer in the long run. So I don't recommend it lightly, but for someone who has that severe form of autoimmune hair loss called alopecia areata, which is absolutely devastating, it's something to consider. Unfortunately, when they go off the medicine, the hair does fall out again. And we're looking at maybe ways to either inject it or use it locally. The topical forms don't seem to grow hair, so it needs to be systemic. And hopefully down the line, it'll help us understand the pathways of hair loss, and we'll have even better treatments.
Okay, somebody wants to know, and I think a lot of people want to know, we've been seeing a lot of reports about how COVID and long COVID can contribute to hair loss. Is this true? I mean, what does your research tell you?
It tells me that it's another form of stress shedding. I haven't seen
Mm,
anything direct about COVID to hair, but I've seen COVID do almost everything to everybody. So some people get brain fog, some people have autoimmune things. I've seen women who are nursing, all of a sudden their breast milk just stops. And women's periods change. So there's all sorts of strange things, both from COVID and the vaccines, and sometimes a
hmm
combination of the two. So we're living in very, very strange times right now in terms of all the things that our bodies are going through. And
hmm
I think the worrying about it is also a problem. So I
Contributing.
haven't seen a direct effect of COVID and hair that's different than COVID and all the other random things it seems to do with the rashes and the just everything, the autoimmune things that seem to come up afterwards. So
Right.
it's hard to know, but I did see a lot of people coming in after COVID with stress shedding of their hair. So it was definitely a thing. And if you went through that, you're not alone.
hmm
But it grows back.
But it grows back. That's good to know. And many others want to know if it's and you referenced this a few minutes ago talking about that medication for that severe form of hair loss. But many people want to know, is it possible to actually grow hair back, or should the aim be to stop hair loss from continuing? So yeah, I think people want to really understand what are their goals here and what's reality.
Well, I always tell my patients I fight for every hair on your head. So my goal is always to grow hair back. That's always the goal. And one thing to remember is that there's a lot of money in hair. And so people have been doing research on hair for many, many decades. The smartest people in the world, all over the world, are doing research, and they are inching their way closer and closer to finding stem cells and cloning hair. So one day, hopefully the near future, because they've been working on it for so long, we'll all just need one good hair. We'll be able to make 10,000 new hairs and just put them in and be done with it and all have too much hair. So that day is coming. But until it gets here, there's a lot we can do. So Rogaine or minoxidil is one product that in the studies for Rogaine, 80% of the women, and this was an 800-person study done for the FDA as an FDA trial, 80% regrew hair, and the hair that regrew was up to 50% thicker. So the common thing people say is, oh, if I stop using it, I'll lose the hair. I'm like, yeah, so don't stop using it. As long as you use it, you'll maintain the benefits. If you stop, you'll lose the benefits. It won't make more hair fall out, but it'll make the hair that was going to fall out won't be protected anymore. And if you were going to get worse, you'll see it. So
Right.
Rogaine is one
And
of those things that works.
it really, really works. I mean, the next question, of course, is what everybody wants to know. What are some of the best treatment options? So
Yeah.
Rogaine, you just mentioned, and
So
it does in fact
minoxidil
grow.
topically,
Uh-huh.
and it's 5% for women once a day. And so that's one. Now, there are compounded versions. So I make a version of minoxidil that's a bit stronger, but I also added finasteride into it, which I wouldn't recommend for women orally, but it's recommended for men. It's Propecia, but topically also has a benefit without systemic issues. And I use that with minoxidil. And then I add niacinamide and caffeine, and that helps grow hair. I have an erbium laser that is amazing for growing hair. And I have some pictures on my Instagram, and I can send you some too if you wanted to use them. But we have patients with all different types of hair loss that we've been able to help grow back using the laser in combination with PRP. And PRP is where we take blood, spin it down, extract out and throw away the red blood cells, and we inject the platelet-rich plasma behind it. And I don't love it for the skin so much, but for the hair, it really does help regrow hair. So the laser uses a process called photobiomodulation that stimulates those stem cells, and then the PRP nourishes them, and then they tend to grow. It doesn't work in 100% of people, but in about 85% of people, it does really well. And I've been surprised that even some people with scarring hair loss have grown back hair. So the scarred follicles are gone, and none of the types of hair loss we've been talking about are scarring. Scarring is when you lose the follicle. And so that would be somebody who has had traction alopecia or who has worn very tight braids or tight ponytails. And in women, postmenopausal, there's a type of hair loss that comes along the frontal hairline where, for no good reason, the hair just starts to scar and their hairline moves back. So we treat that with cortisone injections, but the laser also helps. I don't do PRP for that so much because I don't know that it helps, and I don't want to do something that costs money that may not help. But the
Mm-hmm.
laser has helped a lot with that as well. And
Mm-hmm.
then there are some shampoos that have botanicals that can help support the scalp and keep it healthy. So it's a combination works the best when you use a variety of different things to help regrow the hair. It's not usually just one thing. And then there are supplements that contain ingredients like ashwagandha, curcumin, salt palmetto. And there's one Nutrafol Balance that is for postmenopausal women that works really well. My mom calls it the miracle pill. And
Is
she's
it
regrown hair.
Nutrafol? Nutrafol?
Balance. Nutrafol
Mm-hmm. Oh,
Balance.
mm-hmm. Anything else? Any other supplements that we should know about?
Well, it has vitamin D in it. One vitamin that I think is really critical, and it's for hair too, is vitamin D. And
Mm-hmm.
80% of the US is vitamin D deficient. So it's
Mm-hmm.
you don't get vitamin D from the sun. You get it from either a pill or pretty much from a supplement.
Yeah.
But women who are taking vitamin D should take it with vitamin K because vitamin K helps push that calcium into the bone. So vitamin D is really important. And I just buy a supplement that has vitamin D and K in the same pill, and it really
Mm-hmm.
does help. So vitamin D with K is really important. And it is in Nutrafol, but I still supplement it beyond that and I take 5,000 international units a day, but obviously measure your levels and take what you need. But for hair, you do want to not be vitamin D deficient. One of the myths
I
is that,
take 5,000 a day as well. And by the
yeah,
way, there was a study that came out recently, and an episode I did a few weeks ago, we devoted our attention to it. And because I was really not happy about it, it showed that vitamin D does very little to prevent fractures. But when you really dig deep into the
yes.
study itself, it really indicates that you should continue to take vitamin D.
Yeah, but
Really,
also,
keep taking that vitamin D.
did they look at it with vitamin K?
I don't know. I don't know. I'd have to
Yeah,
go
because
back
I
and look
think
at
that's
that.
one of the
Hmm.
issues is that you need the vitamin K helps push that calcium into bones instead of arteries and other soft tissue. So I
Hmm.
think they have to be precise. And then you need magnesium too for vitamin D
Hmm.
absorption. So it's not usually one thing in isolation. It's a healthy diet, vitamin D with vitamin K, magnesium at bedtime. I think those things are really helpful. And then, of course, it's not over processing when it comes to hair. It's not over processing. You can get your hair colored. A lot of women want to know, can I get my hair colored if I have hair
Right.
thinning issues? And I'm like, yes, I have not seen issues with accelerated hair loss from hair coloring. And so that's not a problem. And it often makes you feel better and look better. So that's fine. But don't over pull the hair. There are people who just always are checking the hair to see if their hair is falling out. Even I just had a keratin treatment, and that's fine too. It can strengthen the hair if it's done well. So if you have gray hair and it's very coarse and it looks like straw, a good defrizz treatment will make your hair look better and can even make it stronger. So just make sure you know who's doing it so that you know you're processing it properly.
Right. In fact, the next question is exactly what we're talking about now. She asks, well, most hair loss is from the scalp, like what you've been talking about, but how can I make my actual hair stronger so it's less likely to break off? So you just mentioned a few of those things. Stop pulling it, maybe stop blow drying it so much or blow frying it,
Yes,
as I like
not
to
too much
say,
heat. And use
not too
heat
much heat.
protectors. Yeah,
Yeah.
heat protectors for the scalp are really good. I like Aveda as a brand. Their botanical line is really good. The Julian Farrell Restore line is really good for the hair. But I think using the right products to protect your hair. There's also hair volumizers and thickeners that can make the hair that you have feel like 5 times more hair. I always put that in my hair and it feels so good. So I use the Aveda one, and it's just a spray and a cream, and my hair feels like 5 times more hair.
Yeah. And your hair always looks wonderful. I like to use a product called Inner Sense,
Uh-huh.
which really, really nice, works with my hair. And, so far, so good on that. And yes, I
And your hair
also
looks
now
great.
use, oh, thank you. Guys, we can see each other even though you can't see us. And Dr. Day, as always, looks absolutely gorgeous. And people did want to know what are some of the products or styling tips that you recommend that you've seen work really well on your own patients or yourself for those who've experienced thinning hair. So you mentioned some products, you mentioned some things not to do. I know there's also like products you can use, like powders that match the
Oh, yeah,
color of
those
your
are
hair
great.
to your scalp so that you don't really see that thinness if it's
Yep,
out
I like
apart.
that. There's
Mm-hmm.
Topic, there's like
Topic,
Maximilian.
that's it, topics.
Yeah, there's a whole bunch of those. Those are great. Madison Reed has some good ones. And then a L'Oreal Root Touch Up is nice too. You can just lightly spray that on. You get good at doing it. If you get the powder, you can get an atomizer so that it comes out a little bit finer so you don't end up with these clumps. You just need a little bit just to coat it so that it kind of hides the scalp color difference from the hair color. And then, so those help a lot for setting your hair. If you just get a set of Velcro rollers and
Yeah.
you put it in when your hair is wet, it really changes the texture of your hair, helps it dry. So if you have time, just put in some Velcro rollers. You can do just a warm dryer to speed it along if you like, and do the hair thickener, a little spray, and then just put the rollers in and hang out for half an hour till your hair is dry. And you'll see it needs so much less of everything else to look good.
Yeah. And I also think, finding a stylist who really knows how to work with thinning hair is also
Oh,
a
for
good idea.
sure.
Ask your
Absolutely.
friends, ask around. If you think someone's hair looks great, ask them who they go to.
And teasing it once in a while is okay, but you don't want to, over tease it.
Yeah, I think overdoing anything, over dyeing it,
Yes.
over blow drying it, over washing it too. I
Yes.
tend to use shampoo only once or twice a week, but I wash it every day with conditioner because I'm a runner. So I'm out there running a lot. But I use conditioner as shampoo because we don't need to shampoo our hair as much, do we?
Nope, we don't.
No. Okay.
Depending on how dry or oily your scalp is, you can just rinse it out if you need to. And even put the conditioner before you go in the shower, let it sit for a few minutes on the ends, and then just go rinse it all out when you're in the shower. That's all you need. And shampooing
Okay.
it once or twice a week is plenty.
Yeah, I really think it is. So, okay, we're going to segue to skin in a moment after this short break. Dr. Day will answer your questions that you sent in to me. Thank you very much, everyone, about common skin issues and your complaints and what to do about them. Stay tuned. Okay, we're back with my very special guest, Dr. Doris Day. Okay, let's get on to skin, a very, very big concern and challenge for a lot of women in midlife. Okay, Dr. Day, thanks for giving us that mini masterclass on hair loss. Now, next, here's a question. I would love to know, this is a direct question, verbatim. I would love to know what a woman over 60 can do with sudden changes in her skin. In the past several months, I've not had any changes in my routine or my food intake or my life experiences. Well, that's not entirely true. I have suddenly found myself breaking out with pimples and some hard spots on my face. She did have a change. She moved. She moved from New York to Boston, she said in her email. Could that have anything to do with it? Maybe change in water? I don't know. But anyway, she wants to know what's going on with her face. What's going on?
Well, sometimes there are changes that are more subtle. So moving is definitely a stress, and stress can be a trigger for rosacea. And that breakout sounds a little bit like rosacea. So rosacea is one of
Interesting.
those things where people say, "Oh, I never had this before." And yeah, it's one of those things you don't have before. It's something that you just get as you're older, and usually in your 30s to 40s and up. And it can occur around the mouth, that it can occur in the mid face. And sometimes also when people say nothing has really changed, but then they do something like a move, they find that they also stayed up a little bit late. They were around a lot of dusty things or things that were triggers, or maybe they just had a few extra drinks or ate meals that they weren't used to. And those meals contain spices or other things that might be triggers. So the triggers for rosacea are alcohol, stress, and extremes in temperature, and some spices. And it's a little bit
Mm-hmm.
different for everyone, and you may have your own personal triggers. So I would say to kind of think about what changed in that way. Did you go to different places to eat than you normally do and have maybe some more foods that you don't typically eat, and maybe they
And
were more
moving is
processed?
stressful. Moving is
Yeah, moving
stressful
is
right there.
stressful, and if the environment wasn't entirely clean, like all of that, and then you don't sleep your normal schedule because of that. So all of that could be a trigger of rosacea. And good thing is that rosacea is relatively easy to treat. It's not something we can cure because as a dermatologist, I always tell my patients, you're stuck with me for life. And we can
That's
control
great.
a lot of
Lucky
things,
them.
but we don't always cure things. So we use topical metronidazole or topical ivermectin, and then usually a sulfa-based cleanser. And that can really help control it pretty quickly. But one thing you don't want to do is pick at those spots, because that will most likely just make them mad, make them redder, make them last longer, and more likely to scar.
So you would recommend that this listener definitely go and see her dermatologist.
Yeah. And they
Yeah.
can prescribe something and get it under control. And if those things don't work, sometimes we do a short course of an antibiotic and it just knocks it out. And then you're back to just where you were with good skin and hopefully happy in your new place.
Okay. So someone wants to know, I want to start using like a vitamin C serum or a moisturizer, of course, and then sunscreen, of course, over everything. What is the proper sequence for all of these different products? And do I really need all of these different products?
Well, depends how motivated you are. The sequence is really important in some cases. So always start with cleansing. Cleansing is probably the most important step, because you want to start with a clean palette and remove anything that was left on your skin that could be a problem. So you want your sunscreen from yesterday off your skin. You want all the makeup from yesterday off your skin, and even the product from last night off your skin. So start with a clean face. Rinse. You don't want a harsh chemical. You just want to use a good cleanser that's going to remove that, but not overstrip your skin. Lukewarm water, pat your skin dry. Then if you use a toner, that's fine, but use that next, because you'll wipe that off. So that's the next thing, is something super watery and thin. And then next will be your serum. So vitamin C serum would come next. And then
And do you recommend vitamin C serum?
I do. I like a vitamin C serum in the morning, because I think it gives extra antioxidant benefit to your sunscreen. And vitamin C, I think, does help against, and there's good data that it can help against free radical damage from UV rays and even pollution. So I recommend a serum, vitamin C serum in the morning. And there's different types of vitamin C serum. So, it usually they come in bottles that are protected from light, and you want to keep them in a cabinet or someplace where it's going to be protected from light.
And then what comes after the serum, the moisturizer?
Then your moisturizer, and then your sunscreen. So your sunscreen moisturizer can go in either order. It can go moisturizer, then sunscreen. That's not a bad way to do it. I might do moisturizer and then sunscreen. Then give your sunscreen a few minutes to sink in. But a lot of sunscreens, especially in the summer, can be your moisturizer. So I get a lot of questions about, is my sunscreen and my moisturizer enough? And the answer is, it could be. Anything that has an SPF on it is a sunscreen. So if it's also a moisturizer, the only question is, are you using enough for it to have a sunscreen protection? Think of it as like those Lululemon pants that everybody was so upset about, where it stretched so much that, it covered the skin, but you could see the skin through it. If you use a moisturizer as a sunscreen and you're putting on so little, you are covering everything, but you're getting so little coverage that essentially you're not really getting that SPF you're supposed to. Right. So you may just, as long as you're using enough of it, then it counts as a sunscreen. If you're only using a little bit and you think you're getting enough moisturizer, chances are you're not getting enough sunscreen protection. So you need another sunscreen to go along with it. Does that make sense?
Yes. And how much is enough? Like a teaspoon for your face? I mean, that sounds like a lot. That's too much,
a lot.
Right?
I would say the size of a dime.
Okay. Size of a dime. That's a good visual. All right. Retinol, something that I started using when I turned 50. Yes. And still do. Retinol, is it still considered the gold standard for nighttime skincare? And is there anything you can do to stop the irritation from happening when you first start using it?
Yeah, so retinol is still the gold standard for sure. I would say it has the most published data, and it's something called an abundance mimetic. What that means is that when you use retinol, your skin will feel like, oh, I have everything I need. So I'm going to make more collagen. I'm going to even out skin tone. I'm going to clean house and do all these good things. So it helps rejuvenate, because it's giving your skin what it needs to do those things and making it feel like it's in a time of abundance. The one thing I'm learning about retinol, though, is that it might be good every now and then to take a break, because too much of a good thing isn't always a good thing and can lead to problems. So I don't know what that break time is yet. And I'm sort of making it up and saying at 2 months, take 2 weeks off and start over again. The way to minimize the irritation is to start slow, use a very little bit, moisturize on top, and you don't have to have a super high concentration. A lot of the over the counter retinols are just fine and actually even better than prescription if you're using it for rejuvenation because they have added in peptides and niacinamide and hydrators. So they're much better tolerated and they convert to the active form as your skin needs. So they do great work. And many of them compare to prescription strength retinols in studies. They just are not making the claims of what the prescription does. And so they don't get, so they don't want to be flagged by the FDA. But a lot of them are really great. So I think that go slow, use a hydrator with it, use a small amount, it goes a long way, and then build up. And I use it right around the eyes as well and on the neck.
Mm-hmm. And on the neck too. Do you think it's okay to use on the top of your hands, or do you recommend it?
Yeah,
also?
no, absolutely. And I make a great body retinol. So there are retinols made just for the body that are really good. And you can look for those as well. Those are good for the hands, the neck, the décolleté, all those areas.
Yeah, we don't really think enough about the body. But listen, you mentioned before about taking a break from retinol, like a little holiday, right?
Mm-hmm.
Well, what do you think about some of those things we're seeing on TikTok skincare fads, right? For example, skin cycling, where it's kind of like what you're saying, where you use the retinol, then you use something else. I think, 2 or 3 nights, something else, then you're back to it. Maybe that's not as big holiday as you're thinking of. But what do you think about some of these skin fads like skin cycling?
I don't know. I mean, I think nobody knows. We don't have data on any of it. Some of it is that if you cycle too fast, you get to the point where you're just over the irritation part where it's helping you, and now you stopped using it. So, and some things, I don't know that you need to cycle, like vitamin C. If it's always squashing free radicals, do you ever really want to break from that? I don't think so. And I don't know that you adapt to that. I do think that there is a lot of research to be done on this.
Yes.
But when you see things on TikTok, somebody is making this up, and generally they don't have a degree in anything. They're just
for sure.
Stuff. So I don't buy that. And I've had patients use retinols for years and only have beautiful skin. So I don't know that we're applying enough or applying it the right way that we really have to worry so much about taking a break. But I think a small break now and then, if I think about like the cycling of the skin and what it does, I would say you shouldn't cycle Retin-A any faster than at 7 days because skin cell turnover is at least that and probably closer to 30 days. So that's why I'm thinking at 2 months, at least in my mind, it's an educated guess based on skin cell cycling.
Right.
But I'd love to see a study. It's just there isn't one.
Yeah. So for now, we'll just stick to everything that you're telling us to do, and we won't do any skin cycling. Okay. So someone wants to know, my face is starting to sag, especially the lower part, the jowls, but I have zero interest in getting a facelift. Zero. What options can my dermatologist offer me to help with this challenge?
One of the things that I've observed over 20 years of practice that is so interesting to me is how different parts of the face age at different rates. The upper face and the lower face age faster than the mid face. So cheekbones and the cheeks tend to look better for longer in most people. Even when I do rejuvenation treatments with injectables, when I inject the cheeks, it lasts for years. When I inject the lower face, it's gone in 9 months to a year. So I always tell patients, if we're going to do rejuvenation, if we're going to do the mid face, you have to understand that it's more of a commitment. You're going to have to come in more often to make sure you keep up with the lower face. Otherwise, it'll be off balance because the lower face is going to age faster and the product is going to wear off faster than it does in the mid face. And there are a series of things that you can do. And I think it's a combination of things. You can use devices like Soft Wave is a great one. For tightening, it uses ultrasound energy and it can tighten the lower face and the neck. My Fotona laser is amazing for tightening and even getting rid of a little bit of fat under the chin if that's an issue, but tightening along there. And then you combine that with fillers to resculpt and define the jawline. All women, our chin recedes as we age. The architecture of the bone structure around the mouth, the teeth, all of that collapses in, which makes us look older. So that reflation is going to take a combination of devices and fillers in order to help people age better. When you see upper lip lines, chances are you might have a little bit of an overbite, and also the lower lip volume is going down and the chin is receding. The mistake people make is that they chase those upper lip lines, and now what you've done is you've made the upper lip heavier and you've projected it more, which actually makes the problem worse, and you don't look better because you've just pushed it all out more. So you always have to treat the source and understand it. So when I watch women, I can see how hard they're working every time they close their mouth, and they're puckering just a little bit. So if I reflate those areas and then we use retinols and peptides and do some devices to just improve the skin, then you'll see that the lines get better. It's not overnight, but they get better and they stay better for longer, and you look natural. So it's never
which is
changing the
really
lines,
important.
it's understanding. So important.
It's so important. What do you think about at-home dermablades or shaving to get that little layer of skin off, and also peach fuzz?
Well, as long as you're not...
Good idea, bad idea?
It's not a bad idea as long as you're good at it. So if you can't see, don't do it. But if you've had cataracts and you have new lenses and you have really good vision, then it's okay. But you just have to be careful. You don't want to be nicking your skin, but I don't think it's a bad idea.
And that's something that can also be done in office, correct?
Yeah.
By a professional.
That's probably better done in office.
And what is microneedling? What's the deal with that? And what does it do? And do you recommend it?
That's one thing I don't recommend to do at home. The home microneedling, I think, is dangerous and does nothing good at all. Products don't get absorbed better. It doesn't go deep enough to do anything good, and it can increase risk of infection. So at-home microneedling, very bad idea. In-office microneedling is interesting. It can help with some lines like around the mouth, although I can't say that it's been the biggest game changer. I do it for stretch marks and acne scars, and I do it for some discoloration like melasma. That's usually premenopausal, but I haven't found anybody come in, and I don't do it a lot for this, so it's not my patients generally, but I haven't had somebody come in from somewhere else and say, I did a series of microneedling for my lines around my mouth, and they're so much better. Nobody's really thrilled with it for that. So it's not my main go-to for that. If I did microneedling for lines around the mouth, I would do a combination. There's devices that are microneedling with radio frequency. It's microneedling RF is what it's called for short. That does better. And that I would do, but not microneedling by itself for just lines. I just don't think it does much. When we do microneedling, we always combine it because with other things like peptides, growth factors, sometimes PRP, but not typically PRP. We have better things than that cost less. But what you've done with microneedling is you've created this control wound in the skin, these channels into the skin. So now we want to take advantage of that. So we create for each patient something specific to deliver that they need, whether it's for brightening or lines or collagen production to help stimulate that. And that makes the microneedling work even better. So microneedling is a means to an end, but as a treatment by itself, I don't find it to be the best thing for rejuvenation.
Okay. And what are the absolute, this is from a minimalist person.
Yes.
What are the absolute must use products for women over 50? Like what are they that I really have to be using?
Sunscreen, a good cleanser, retinol. Those are the main things. And then I would just say those are the main things. And then a good moisturizer if you're dry.
Yeah, moisturizer is key, but you don't have to go crazy with moisturizer, right? Like you don't have to.
No, I really like the La Roche-Posay Lipicar AP Plus Balm. I use that even on my face sometimes, but on the body, it sinks in so fast. It's a really nice moisturizer. And if you wanted to use one for everywhere, that's an easy one.
That's a great line.
It's a great line. And so I think that's it. I think it's just a good cleanser, And if you really want to be minimalist, cleanse at night, rinse with water in the morning, sunscreen in the morning. The most important part is the bottom of the neck. Put it on in an upward motion from the chest up towards the chin, because you want to cover the bottom of the neck and the sides of the neck, then your face, and then at night, a good cleanser to wash it off, and then your retinol and moisturizer. That's it. Super simple. That's a minimalist view. If you want to get a bit more complicated, add the vitamin C under your sunscreen in the morning.
I really do love using vitamin C. I think it's really has worked on my skin. I think it's brightened it up considerably. So I personally recommend that. All right. So we are running out of time. We did have more questions, but we couldn't get to all of them. So we know you'll come back, won't you?
Oh, anytime. You ask, I'm in.
It's so funny. You're so great. So this was informative and fun. And would you just maybe leave us with 3 of your top tips, your takeaways from our conversation today?
When you look in the mirror, look for what you love the most about yourself. So look at yourself and say, oh, I have beautiful eyes, or I love my bone structure, or my skin tone is so pretty today. But say something nice. Look in the mirror and get over the and get to the, this is what makes me beautiful and special. These are my signature features. For hair, maybe move your part over, like change your part, because that can give your hair some fluffing. The hair thickeners and the curler thing can really give your hair a lot of volume without any damage or a lot of work. So that's really good. When it comes to skin, the areas that I see aging are around the mouth and the neck. It's never too late to start sun protection, and good hydration alone will add so much water to your skin and will instantly make lines look better. So hydrate your skin, make sure that you drink enough water, but also hydrate from the outside. And don't be vitamin D deficient.
Yeah, we love that vitamin D. And everyone will have a lot of information about Dr. Day and her books that I mentioned earlier in the show notes and on my website as well. So Dr. Day, again, thank you. And I can't wait to have you back because we still have so much to talk about.
Thank you. I'm excited. I'm already looking forward to being back. Thank you so much. Thanks, Barbara.
Thank you. Bye.
Bye.
Thanks for tuning in, everyone. If you enjoyed this episode of GRUFFtalk, please do 2 things. First, share it with all your friends and family, and subscribe to GRUFFtalk wherever you listen to podcasts, including YouTube, so you never miss a single episode. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon.